Welcome to the Bomba Pod. I'm your host, Martin Bomba, and each week we bring you meaningful conversations with guests who uplift, inspire, and encourage you to become the very best version of yourself. Whether you're chasing a dream, building something new, or just looking for a spark of motivation, you're in the right place. Produced by Dennis Ayotte and proudly supported by Window World and PJ's Coffee of New Orleans. Let's grow together. Let's be inspired. Let's get started. Hey everybody, it's Martin Bomba. Welcome to the Bomba Pod. Today's guest is Allison De Paoli. She is the founder and principal of Altique Consulting, and they help provide benefits and help find benefits to reduce costs while improving employee access to care. Allison, thanks so much for being here.
Pleasure to be here. Thanks for having me.
As I understand, that's just a small part of what you do and who you are.
Yes.
Good. Well, we'll find out a lot more today. Tell me about how you got into the consulting business and the health providing business, and where did it start? I know you're from Florida. Tell me about Florida.
So I actually grew up in Pennsylvania, and after I graduated from college and worked for a few years, I went to work for my parents. And my father and my stepmother owned a boutique employee benefits consulting practice. We did a lot of self-funding plans, and that was the Wild West time in healthcare, health insurance. We could do anything. I mean, we built crazy plans, and it was fun. And then I got married, and I moved to Texas, and I pivoted into another part of the employee benefits space. And after about 12, 15 years with a particular carrier, that, you need to change, you need to move on. So I was looking around at what was happening with some of my clients on their medical plans, and I was like, why is this happening? I know how to fix that. Why is this happening? We could do this way, and this would solve the whole problem. So then I decided I should just go do that.
What do you think some of the misconceptions are that people have when they start looking for a health plan?
That there's only large carriers to choose from, that you cannot design a plan that works for both your budget and your employees, that the only way to contain costs is to shift the burden either by degrading your benefits further or by shifting more of the cost onto your employees. Those things aren't true. Most problems in a healthcare plan can be taken care of with proper contracting. And proper contracting is something that doesn't really impact an employee because they don't see that. They still go get their prescriptions where they get their prescriptions, and they still go to the doctor where they go to the doctor. There's just, as you've added layers between the provider of care and the payer of care, every layer adds a little bit of cost and a little bit of cost and a little bit of cost and a little bit of cost. And at some point, it's a lot of cost, and most of it is hidden and undisclosed. And that is now a huge problem for employers.
Well, there's so much legalese
Yes.
in it and so much fine print
Mm-hmm.
in those plans
Yes.
that a normal person who doesn't know what they're doing would just be lost.
Correct. Absolutely.
And they're counting on that, I think.
Yes,
Feels
they are.
like it feels like it. I shouldn't say that, but it
they
sure
are
feels like
counting
it.
on that. And I would, there's a whole conversation about how healthcare is broken. It's not broken. It's working very well for large hospital systems. It's working very well for large brokerage firms, and it's working very well for large insurers. It is not working for people who pay for it, which for 50% of the population is employers. And it's not working very well for people who need to use it, patients.
Is that a big reason, big healthcare? And I mean, obviously, it's been in the news very recently with the shooting that happened,
Mm-hmm.
and what that motivation was for that shooting. At least that's what the shooter said. Is the frustration level that high now that
Yes.
it comes to that?
I think the frustration level is that high. I don't want to make an excuse for somebody. There's no reason to shoot somebody in the back in the street.
No.
We're not living in 1865.
Agreed. But I understand the frustration.
Yes.
I've seen it, just being in the hospital.
Mhm.
and sitting in the waiting room and looking around. And trying to get your benefits and trying to get a procedure that you need and having to jump through every hoop imaginable. Why is it different with the smaller carriers, and what do you do to find those people that make it a little easier for people?
So it's not so much changing the provider. In my experience, most physicians really just want to take good care of people and are hamstrung by a variety of things. But it's contracting, right? So sometimes you need to use a network, right? A United or a Cigna or an Aetna or whatever the network is, because
Right.
you need a way for people to use to find a provider, right? So you need to use a network. But for larger kinds of claims, if you can arrange to pay a facility directly, preferably the day that that the patient is being treated and in full, you can get some pretty big discounts because an average provider, if that is a doctor's office, a specialist office, a hospital, an outpatient facility, they spend 40 cents of every dollar they collect on collecting the dollar. So if you can eliminate that cost,
That's
if
value.
that's
That's a
all you
value to
get,
them.
if that's all you get is a 40% discount, it's
Yeah.
okay. And usually you get a bigger discount than that. It is a different conversation. It doesn't work for every provider. And what I would say is let people go to the doctor, whatever doctor they would like to go to. One of the big oxymorons in health insurance is that you want to keep people from going to the doctor and we want to make them great consumers. And that's great in theory. But if you don't give somebody the tools to allow them to be a consumer, right? You can spend 5 hours researching a TV, a GoPro camera, your next laptop. Those tools are not nearly as readily available for healthcare providers as they are for stuff. And some of that is because it's not quite the same. But let people go to the doctor. Make it easy for them to get their checkups, make it easy for them to take their maintenance medications, right? If somebody has high cholesterol and it is appropriate for them to be on a statin, or if they have high blood pressure and it's appropriate for them to be on a high blood pressure medication, or they're pre-diabetic or diabetic, make sure they can afford their medication. And I know this is going to sound a little foofy in today's world, but there are times when somebody cannot afford to take a $30 a month medication. Make it free. It's cheaper for you to pay for the medication than it is for them to spend $40,000 in the emergency room one day because they're not taking care of whatever they need to take care of.
Which I have never understood. It's so counterintuitive to keep someone from getting good health care,
Mm-hmm.
and then on the back end, you're paying so much more
Yes,
to keep them alive.
correct.
It's insane.
You know, we had a client for many years that their claims, their everyday kind of claims, were remarkably low. But every 12 to 15 months, they had this $4, $5, $800 million claim. And invariably, it was an older Hispanic gentleman who was not well, who did not take his medication, and had some combination of diabetes, high blood pressure, cholesterol, started losing body parts, couldn't breathe anymore, and died. It was horrible to watch. Well, if you spend a little more money keeping that guy well, and that's a challenge, it's not the easiest thing, but if you can focus your efforts on keeping people well, you have less of the crazy stuff. And that doesn't get talked about enough. We talk about making people responsible consumers. Well, how are you as a person supposed to know that there's a place in San Antonio you can pay $375 for an MRI, or you can pay for one next door and pay $4,000? How do you know that?
I would have no way of knowing that.
Right.
None,
Well, we
unless I had a professional who
Correct.
specializes in that and can point me in the right direction.
Right.
It's just, to me, it's just amazing how, and I'm certainly not meaning to speak terribly about our health system, but it does need some help,
Mhm.
obviously. But going even further than that, I was talking with somebody today about this. You see these ads on TV constantly for all of these medicines that fix all of these ailments. The next ad you'll see is for the latest, greatest combo meal at your favorite fast food joint down the street.
Yep.
That's big enough to serve 2 people minimum.
Yes.
Minimum, right?
Yes.
Why don't we start looking as a country at getting with these companies, cut your portions in half, cut your price by 40%. You're still making 10% more than you would have made, but you're feeding people a normal amount of food that's not going to make us the obese nation that we've become. I mean, that in and of itself would have to take a tremendous load off of our healthcare system.
So I think public health went out the window about 25 or 30 years ago. If we could have more focus on public health, then some of those problems would be addressed. I don't really understand the metrics of the restaurant business, so I'll leave that to the restaurant people. But if we're going to talk about specialty drugs will typically be 1 to 4% of the number of prescriptions that a health plan fills, but probably drive 80% of the cost. There are real reasons that you put in a prior authorization process. And a lot of that is patient protection. You know, there are manufacturer instructions for expensive medications or any medication, but particularly for specialty medications. So you want to make sure that those manufacturer instructions are followed. You want to make sure to be fiscally responsible. And if there's a step and a step and a step before you get to the $80,000 a year drug, yeah, you want to enforce that. People hate it, but you want to enforce that. If there is a biologic available, you want to make sure that the biologic gets tried. And one of the other secrets that nobody realizes is that for a lot of these things, there's genetic testing that can tell you which drug is right. Now, if your choices are spending $10, $50, $80, and $125,000 for a drug, do you not want to spend $300 or $400 to figure out which one might work?
Kind of makes sense to me.
Because the FDA will clear a drug when it solves the problem for about 35% of the population. Well, for the other 65% of the population, the drug doesn't work. So find out if the drug works.
Yeah. And there are so many different new tests that have just come on the scene in the last probably 4 to 5 years.
Oh, all the time.
And new ones all the time. I mean, there are tests now that you can do that are non-invasive that will tell you if you have blockage or not.
Mm-hmm.
I mean, these are things that are science fiction 10 years ago.
Yes.
So why are we not utilizing that more? And why are insurance companies not saying, look, we will do this test for free. We'll allow these tests for free because we know what it's going to save us in the long run. Why do they not do this?
So can I throw a little insurance ease at you?
Sure. I may not understand it, but go right ahead.
Okay. So the Affordable Care Act, and we'll leave the politics of that aside.
Yes.
The Affordable Care Act required employers or required health plans to spend 80 to 85 cents of every dollar, depending on your size, on paying claims.
Required that.
Correct. Now, when you sit here like this, that makes a lot of sense,
Yeah.
right? Well, even the nonprofit insurance companies are profit-making machines. And the for-profit insurance companies have stockholders, shareholders to answer to. The only way that they can grow their revenue is to allow your claims budget to continue to expand. Otherwise, their revenue stays here. So they can't grow it if the claim fund doesn't grow. And we've seen some very creative ways that those claim funds grow and how people are paid, right? So you have to kind of parse through the contracts to see where the money is being paid. It is not in an insurance company's interest for your costs to go down. It's in your interest, and you need to act as the employer in that interest. Nobody else is going to do it for you.
Yeah, because you're cutting into their profit.
Yes,
Yeah,
heavily into their profit.
do you think that the bureaucracy and the red tape that consumes the industry now has been the catalyst for a lot of doctors leaving the profession or going into private concierge medicine?
Short answer, yes. I let me say first that we are a for-profit entity. We think that businesses are in business to make money, but I'll go with the Texas saying that pigs get fat and hogs get slaughtered, and we are well into hog territory. If we could stay in pig territory, we'd be okay. And I know that sounds very harsh, but it's very true. And there are so many ways that so many entities are making money off a dollar. And private equity is entering the healthcare space at a very rapid pace. And they come into an area and they'll buy radiology. And all of a sudden, radiology options get skinnier and price goes up. They'll come in and they'll buy 3 neurology practices. And all of a sudden, prices go up and you can't get this and you can't get that. You can't do this way. And that is bad for patients. And doctors often see 2 choices. They can retire or they can go work for a hospital system. And I will tell you that doctors working for a hospital system, however well-intended that may be, is bad for patients. Your choice of providers has now been shrunk into whatever that hospital system is because they can only refer in their system.
Right.
And they are required to generate so much revenue. And they may tell you that they're not, but they are. They're required to generate so much revenue, which means all of your testing is happening in this environment where nobody else has control over the price. So you end up paying $2,500, $4,000, $7,000 for an MRI that you could pay $375 for down the street, or maybe $500 2 blocks over. I don't have a problem with either price. I got a problem with the first price. So those are things that people don't. If you're in the hospital or a family member is in the hospital, you don't care about any of that. Nor should you. But it's all the things that are happening to you.
From an emotional standpoint, you don't and you can't
Correct.
care about those things. From a practical standpoint,
You have to.
you have to.
Mm-hmm.
And I certainly understand that. Let's talk about GLP-1s. GLP-1, I mean, how can we not talk about GLP-1s when we're talking about healthcare now? GLP-1s have revolutionized weight loss in our country now. Again, wouldn't it make more sense to make GLP-1s very affordable to people who really need them rather than to keep them as expensive as you possibly can and continue to reap the bad benefits of obesity in the end?
So the sort of industry joke is that the only people that are paying a lot for a GLP-1 are employers. You know, you can go buy a GLP-1 for $150, $200 a month.
Yeah.
You can go to Lilly Direct or Novo Direct and you can buy branded Ozempic or branded Mounjaro for Mounjaro now I think is $400 a month, and they're going to drop that price pretty soon. So one of the strategies there is to design your plan so you can access those programs, right? But those drugs, you know, at Ozempic, you pay depending on where you fill it, and that's the other thing that that confuses people. Well, the drug costs what? No, it costs something here, it costs something here, it costs
It's
something
different
here, it costs
everywhere.
something there. But you can design those programs so that you can access that. But employers, Ozempic is $900 to $1,200 a month. It has a $300 or $400 rebate, which is basically an interest-free loan to your PBM. until you get that back. It's 6 to 9 months later, whereas you can pull that out of your plan, send somebody to Trump Direct with a mechanism to pay for it, because most of them are listed on the Trump RX plan, or you can go directly to the vendor and pay much less for it. But somebody has to tell you that that's possible.
And I think most people don't know.
Correct.
Still, most people don't know.
Correct.
We'll talk about how to get them that information and what resources there are to help them know this information after we take a little break. We'll be right back with Allison De Paoli.
This is the future team.
Oh yeah, Window World, we've been family owned and operated for 4 generations. We can't wait to see what these little guys do when they take over. Okay, maybe we can wait. I think that's best for everyone.
Want service that's honest? Window World. Service for generations.
These windows are seriously the easiest windows to clean on the market. Just a little bit of this glass cleaner, put it on there.
Window World has been family owned for generations, which means chores aren't just chores, they're part of professional development.
You got this, Layla. It's wax on, wax off.
Needless to say, things are a work in progress. For squeaky clean service you can trust, call Window World. Service for generations. Hi, everybody. We're back with Allison De Paoli and talking about healthcare, which we discussed, Allison, during the break. It's such a dry subject, right?
Yep.
But somehow you're making it interesting,
Well, I'm glad.
and I appreciate that. But I also believe, dry or not, it's such an important thing to talk about.
It's 20% of our economy, and 50% of that cost is paid by employers, large and small.
So you threw out an enticing carrot for me when we were on break. You said, ask me if I have health care. Do you have health care?
So I have health care, but I do not have health insurance.
Okay. So tell me how that works for you?
Okay. So we are a small business. We have less than 10 employees in our firm, and we're all pretty healthy. So we have a relationship with something called a direct primary care physician, and I'll explain what that is in just a second.
Okay.
And then we have backup, because I think that's the right word. It's not insurance, it's backup. If a large claim were to happen to any of us, we have a health share, which we pay for every month, that will take care of those expenses if they reach a certain threshold. And that threshold for us is $2,500. So if I incur a medical expense and it's more than $2,500, the amount over $2,500 I send to the health share, and they reimburse me for that.
That's outrageous and so
In a
cool.
good or a bad way?
In a good way. In a great way. Now, I will tell you, I've been skeptical about programs like this because you're constantly inundated with them on social marketing,
Yep.
and especially if you're listening to Sirius XM or something like that.
Yep.
TV now, it's got it. The guy that talks about his dad dying when he's and then there's another one that is a Christian health share.
It came out of the religious communities that wanted to take care of their own members. So they pool their members and they pay their bills. It has evolved several times since then. There's still a basis of that. Most of the organizations will say that they are faith-based or Christian-based. You don't necessarily have to be to participate, but it is an arrangement. It is not a contract like an insurance policy, and I think that's important to know. The other thing that's important to know is basically if you have to go to the hospital, you are presenting as a cash patient. Now, given what we do, we're quite comfortable with that. Not everybody is.
Right.
We have some accountants on health shares. They're the happiest people we know because they pay very little. They tend to be pretty healthy. At least our accountants tend to be pretty healthy. They go to the doctor once or twice a year, and they're good. If you have a black swan event, I think it can probably be a problem, but there's ways to ameliorate that also. But we pay a third of what what health insurance would cost us. It doesn't work for large employers, and it probably doesn't work if you have more than 10 or 20 employees because you have a diversity of population and all of that. But For us, it works.
And for a small business,
It can work.
i.e. 10 or less employees who are struggling to pay their bills doing this or that, that can mean a world of difference.
It can.
It's amazing. And can you do this if you are a large employer or a medium employer, and you're providing the health insurance for your, or at least offering the health insurance for your staff? Can you, as the owner of the company, take advantage of health share
So the ACA requires
as an individual?
Okay, so as a person, yes, but the ACA requires that employers with 50 full-time equivalents or more offer health insurance to their employees. So a health share will not count as health insurance. But once you get 50 is still a little bit on the small side. We can do some good creative work for 50. But once you get to be 70, 80, 100, more than 100, we can kind of build you a plan that includes DPC and a self-funded plan. And we have really a good track record with converting low-level claims. Let me give you an example. We have a client that when we took them over, the prior plan year, there were about 190 employees on the plan, and of their claim spend, $447,000 was in the under $10,000 bucket. That means somebody went to the doctor and somebody broke an arm and somebody had the flu and some child had pink eye and, garden variety things.
Daily
right?
occurrence type things.
Daily healthcare kind of things. We instituted a relationship with something called a direct primary care physician, and we converted that expense from $447,000 to, at the plan year end, that expense will be just under $200,000, including the fee paid to the direct primary care physician. So direct primary care is like an old-fashioned kind of doctor wrapped in a modern payment model. So direct primary care physicians, and they're growing fast, and more of them are coming online all the time, and I think it's wonderful for patients. They are a doctor or a practice of doctors, and their panels typically have 600 or less patients rather than a 3,000 patient panel for a fee-for-service doctor, so they're easy to get. They do an annual assessment. They do labs once or twice a year, depending on your age. They are available if you need to see them. You can typically see them the same or the next day. They answer phone calls. They answer text messages. They might text you. You can talk to them on a video chat, and they are typically, there is somebody on call 24 hours a day. So,
And they're not ready to leave the minute you walk in.
correct. And so you have actually medical care from a doctor who understands who the patient is in front of him or her. It is a subscription model of payment. So you're paying a fee every month if you see the doctor or not.
This would be a concierge doctor.
It's not concierge.
No?
Most concierge doctors bill insurance in addition to your fee.
Okay.
And concierge will often do house calls and things like that. DPCs typically don't do house calls. Typically, you have to go to them, but they are available. They return phone calls. If I'm old, I've been getting, I lose my voice every 12 to 18 months since I've been 22 years old. I just text, it's back, and my medicine gets called in, and I don't have to go see them.
Reflux.
I lose my voice.
But what causes that?
It's usually when I'm very, very busy and I'm exposed to a lot of people, and I will get a cold and then I will lose my voice.
My goodness.
It's
And you've been
just-
doing that since you were young?
Uh-huh.
Wow. That's crazy.
So then I just, and I don't have to go, right? And my medicine gets called in, I go pick it up, and in 2 days I'm fine. So it is more thoughtful type of care. So
How cost effective is that?
it is incredibly cost effective for this client that I was just talking about. We cut their cost in half after the subscription payment.
And the subscription payment, is there a from this to this?
It's at 30 days, right? Typically, they're between $100 and $200 a month, maybe just a little bit under 80, 90, whatever. When you do that through an employer, it's typically less expensive than if you would go do that on your own. But most DPC doctors take standalone patients, right?
But they don't utilize insurance and they don't take insurance.
Yep.
Then that's what I'm going to.
Yeah. So for labs, like,
and it's great. You can go and get your labs done there.
my labs cost $5 a test. That's what my DPC doc charge. I know other DPC docs that charge whatever the test is and a $20 draw fee. They typically have contracts with imaging centers. So if you need an x-ray, you can go get an x-ray and it's, $50, $80, right? It's
But it's
really
not in the
not very
thousands.
expensive. It's not thousands of dollars. Some of them do more services in their practices. They're very big on, do you sleep enough? Do you eat these things? They're called vegetables. They're green. You should consume them sometimes. Do you walk around the block? They're
More holistic.
in how they treat people.
And there's so many more of those popping up all the
Oh, yeah.
time. There's one in New Braunfels called Blue Agave.
There's 12 in New Braunfels.
Are there 12 of
There's
those?
12. I was talking to one the other day. I said, I'm so glad I found you. I have a client that has some patients. He said, Allison, there's 12 of us. We meet for lunch on Thursdays. Would you like to come? I'm like, yes, I would like to come.
Wow.
12.
That's wow. And that, and several years ago, and I'm talking not a long time ago, 5-6 years ago, you had maybe heard of one or two.
And they were crazy, right?
Oh yeah.
Why were they doing that?
Because they were crazy, and there was such a misconception about what it was that they did. I think people really thought they were like witch doctors.
Uh-huh.
That they instead of prescribing something for you or taking a blood draw and doing actual tests, that they would give you some kind of paste to put on it or some kind of herb to drink, and that's not what it is.
Nope. It is good old-fashioned medicine.
And whenever I got over that, because I'm one of those people that thought that in the early days, when I got over that and I went to one, it's really quite amazing because they do care about your health. They don't just care about you taking a pill
Nope.
or a medicine. They care about how to stop you from getting to that point. And if more people did that, again, going back to our very original conversation about why we don't pay more for prevention and less for treatment instead of the other way around. It's
Correct.
And that's a way to do that.
Mm-hmm. I wholeheartedly agree. We work very hard to build plans like that. We have a client with an on-site clinic. First off, people love free healthcare. They can go to the on-site clinic if they're on the health plan or not, full-time, part-time, whatever, it doesn't matter. Most of them want to be able to bring their spouse or their kid. We're working on that. That's a space constraint, but we're working on that. And those people who have the on-site, who use the on-site clinic, cost the health plan after the on-site clinic fees are built in $1,200 less per employee per year.
What a savings.
So for this particular employer, that's about $500,000 after the clinic is paid for. So there's real savings here. And that is a real retention tool for them. And they love the doc. I go there, people are like, I saw Dr. Bob. He's great. I know. I like him too. But they're just thrilled to death.
Well, one of the things that is nice about that is, let's say you're an employer who's paying 50% and your employee pays 50% or whatever the split is. It's feasible that at a certain point you could be paying 100% for them and they're not paying for their health care, which is also a huge thing to retain employees.
It is huge. We have a new client that their weekly employee-only contribution was $5.
Wow.
And they were getting hammered. We adjusted some things for them, and I think we increased it to $7.
Oh, outrageous.
But that is the lowest I've seen in a long time. But the client that I just mentioned with the on-site clinic, their budget has not increased very much over the past 7 years. Their employee contributions have remained flat, no increase to employee contributions. And we have cut the dependent contributions, the employee child, and the family tiers twice.
Wow.
And that means something to those people, particularly the employee child tier, because that is
Absolutely.
usually single mothers.
Wow. I am learning so much today. I love this.
Good.
You talked earlier about people like free healthcare, and of course, who doesn't like free? It's
Yep.
great, but somebody has to pay for it.
Correct.
What do you say to the people out there that look to our north in Canada and other places around the world that have socialized medicine, socialized healthcare? We've seen the nurses fleeing that
Mhm.
and coming to the United States because of it's not working for them. What would you say to them in response to that? Well, socialized medicine, that's the way to go.
So I have a nuanced response to that. So I think when you look at, there are probably 4 or 5 predominant socialized medicine systems throughout the world, and some work better than others. The ones that work well have a fair amount of fiscal discipline. The ones that don't work well do not. And I think for acute care, most of those systems are fine. If you're having a heart attack, if you've just been in a car accident, if you're having a stroke, you're probably going to get good care and you'll be fine. If your knee is bothering you, you're going to wait a long time. If you have the flu, you may or may not get what you need right away. If you think your routine kind of things and your low level things that need to be addressed may take a fair amount of time to be
Elective
addressed.
surgeries, for instance.
Elective surgeries can be put off for years. Right? So it is a different rationing of care. And people say in the United States that we do not have a rationing of care. We absolutely have rationing of care in the United States. Who can pay and who can't pay? Now, the human part of me says that's probably not the right way to do things, but I don't think that socialized medicine is the right way to do things either. If you look at the Swiss system, that's probably one that performs more effectively than most of the other ones. It is a privatized but highly regulated system. Now, Switzerland is also a relatively small and fairly homogeneous population, which makes that work a little bit better. But the Malaysian system is also quite good. It is a public system. People get what they need with alacrity, without a whole lot of cost. You can price shop in a more reasonable manner. And I think there are things to be learned from those systems. I think certainly in Texas, where we already think we're our own country, socialized medicine is not going to fly.
I think that would be difficult sell.
Yes, and I don't think in most places when people understand what it is, it's not going to fly. But I certainly understand and respect the frustration.
Yeah, and I get grasping for
Anything.
anything that would be better than what you have, especially if you don't have health care or you're struggling to make those healthcare payments every month and you have children. It is a difficult answer.
Yes.
It's a difficult answer.
It
but
is a complicated question, and there is no one solution. There are several things.
which is why you represent very varied things.
Mhm.
Yeah. I don't want to quite switch gears just yet because in the next segment I want to talk to you about the National Association of Women Business Owners, what that means to you, what that is, because I had to ask you what that is, embarrassingly. And we'll talk about that in your charitable and philanthropic endeavors, shall we?
Sure.
When we get into our next segment. But closing on talking about insurance and the pratfalls of insurance and pitfalls, I'm sorry, of insurance. What would you say to somebody who doesn't know where to go, doesn't know what to do, and needs to get started to get health care?
So I think the first thing is if it doesn't pass your smell test, it's probably not right. And I think people have just kind of turned a blind eye to it because they don't think that it's a choice. But I think if you are a consumer, The very first thing is just because your doctor prescribes something or says that you need to have a test doesn't mean you have to have it. You can ask a few more questions. You can talk about the risk of action and the risk of inaction, because there are always risks on both sides. So make sure you understand that. And if you need a little bit of time to think about something, take the time. And I think this is particularly important when you have a rather substantial diagnosis. And, Bill Henrich was the UT Health, head of UT Health for years and years and years. And he had a cancer diagnosis. And he went to one of his team and he had his diagnosis. And he said this from the stage. And he said, I said to my doctor, who I respect, I hired, I respect, and I think is very capable, said, I'm going to have a second opinion and I hope that doesn't upset you. And the doctor said to him, I would be very upset if you didn't go get a second opinion, and I hope I'm wrong. And you want a doctor with that kind of attitude rather than the have to do it now, must take a minute. If you're having a heart attack, that's different. But if it's a diagnosis, take a beat.
If it's a dire diagnosis,
find providers that understand you and you understand. So that's from the patient side. From the employer side, if you're small, there are only so many things to be done. Can we back DPC into a health plan and make it work a little better so people can get what they need? Yes, but there's only so many dollars and there's only so many ways to cut that risk, right? You can only slice it so many ways.
right.
Once you get to be a little bit bigger, over 50, even at 50, there are some really good strategies to use to contain your costs long term and turn benefits into the recruitment and retention tool that it's supposed to be. And a $7 a week contribution will kind of get that started. Access to free healthcare will get that started, right?
Absolutely.
And then contracting. You want to know how people get paid. And I don't say that because I don't think that people should not get paid. People need to be paid for their service, right? But you have a right to understand how they're getting paid. And let me give you an example that most people don't think of. We have a plan member who takes Skyrizi, and Skyrizi is about an $80,000 a year drug. This particular person goes to the guy in San Antonio, and the guy totally blew through every PA practice, every PA that was put in his way. And this is an executive, and we ended up doing an override for him. And what the plan doesn't know is that this doctor gets $163,000 a year from the manufacturer of the drug.
Why is that not illegal? How is that not illegal?
Well, you can find out. You go to openpayments.gov and you can find that information. And so you want to know that.
But again, how in the world is that even remotely legal?
But doctors can't own hospitals.
What you can't pay a DJ to play a record.
Correct. But you can pay somebody.
That's called payola. What is
correct.
this?
It's this payola.
It's payola.
Correct.
Wow. This is mind-blowing that
happens all the time.
And it's legal.
It's legal. Wow. But that should give you some idea of the scope of and like comes in everywhere.
I'm glad you're doing that and not me. I really am. I'm glad I'm the guy talking here. We're going to take a quick break. We're going to be back with Allison De Paoli, and we're going to be talking a little bit about her charitable side and the nonprofit that she works for. And no, she doesn't work for it. She's the chair of. And we'll do that when we come back on the Bomba Pod. Thank you so much to our sponsor, PJ's Coffee of New Orleans. If you want to try the very best small batch roasted coffee that you're going to find anywhere, look no further than PJ's Coffee of New Orleans. 2 great locations to serve you in the San Antonio area at Camp Bullis and I-10 and at 281 and Bulverde Road. You're going to find all your favorites at both locations, from wonderful espressos, macchiatos, you name it, they've got it, as well as some delicious energy drinks, as well as our signature granita. And beignets, yeah, you bet we have them, and they are phenomenal. Be sure to stop by the PJ's closest to you and try any of our wonderful coffees, teas, and pastries. Thanks again to PJ's Coffee of New Orleans for sponsoring the Bomba Pod. Hey, everybody, we're back on the Bomba Pod with my guest, Allison De Paoli, and we are talking about healthcare and the healthcare industry and things that you can do to mitigate some of the costs, the astronomical costs that are involved in healthcare. But we're going to shift gears a little bit and talk about the other kind of half of your life that is fulfilling in a different way, I'm sure.
Yep.
And that's the charitable and nonprofit side of your life.
Mm-hmm.
Formerly the president of NAWBO?
Yep. NAWBO San Antonio.
National Association of Women Business Owners.
San Antonio chapter.
San Antonio chapter. And you're still involved with the Blood and Tissue Center.
Yes, I am.
Which we're always in need for
Oh,
blood
yes.
and plasma, always.
Yes.
And let me ask you, how are we addressing that? I want to talk about NAWBO for sure, but how are we addressing the shortages that we have in blood and tissue? Is it just a constant battle to ask people and ask people and ask people?
It is a constant battle. I think it's getting a little bit harder. I know the pandemic didn't help sort of the intake of younger donors was severely thrown off track for a few years. And if we could get people to be more consistent donors, that would solve a lot of the problem. You can donate 3 to 4 times a year, if you're a healthy person, 3 to 4 times a year. And I would strongly encourage you to do that. And as somebody that cannot give blood, I would really strongly encourage you to do that. You can give platelets. They do tissue collection, tissue harvesting there. And, they were the first cord blood bank in Texas.
Really?
Mm-hmm.
I did not know that.
You can go and see if you do a tour, and I'm happy to arrange a tour for anybody. They have the big coolers. They're not coolers, freezer things, and they come up and you can take this out, and it's fascinating.
A vampire's dream.
And they do mobile leukapheresis, which is for TCAR therapy, because TCAR therapy can be very beneficial to the right patient, but there's only...
Please explain what TCAR therapy is.
TCAR therapy is for some serious illnesses that require special kinds of cells. And you harvest the cells, they do something to the cells, and they give you your cells back. I don't understand all the details of that. But we are the first mobile leukapheresis collection entity, I think, in the world. And last year for the ball, they raised $1 million, and they bought the second mobile leukapheresis bus. And those buses, they work here, but they will go into the valley also, because there are many patients there. They can't necessarily get to where the harvesting is done and where the T cells need to be delivered. So they will go to you to do that.
Wow.
Fascinating.
That is fascinating. Well, I will tell you this, that the blood bank does a tremendous job of follow-up.
Yes, they do.
They do a tremendous job of follow-up. I gave blood a few months ago, and like clockwork, every week I get a blood and tissue email asking me to come in and give some more blood.
I don't know if you've ever had a tour of their facility, but they have like a command center where all the orders are coming in from hospitals and different places, and then they have the refrigerators where the blood is. And some days there's not a lot of extra blood.
What is the shelf life of whole blood?
I believe that the shelf life of whole blood is 42 days.
That's not long.
No.
That's really not long. And
No.
if you have some kind of a mass casualty
Well, when we had the
situation.
Sutherland Springs shooting, which I think is the biggest mass shooting we've had here, they got blood from everywhere. Not only did they have people lined up at almost all of their donation sites, but they got blood from a lot of places because they simply could not accommodate the need in that period of, it was hours that they had. So they got blood from a lot of places.
Well, I think that, and you correct me if I'm wrong, but if you see a mass casualty event or a mass injury event, I should say,
Mm-hmm.
do people step up typically?
Yes.
Normally they do, right? I mean, that's
Yes.
whether they gave or not in the last 5 years, it doesn't really matter at this point. They're going to go give some blood.
Yes, and I think that I think that's wonderful, and I would never want to discourage that. But I think what a lot of people don't realize is that the two biggest users of blood, or almost the two, are maternity, babies,
Yes.
and cancer patients, and those needs are ongoing every day. And I think most people don't realize that those are two groups that use a significant portion of the blood supply. And that's not the, oh my gosh, there was an accident, let me help. You don't see that.
And blood donation and blood collection, it's not like running a restaurant where you can say, okay, on a given week I need to order this many dozens of eggs and this many. You don't know how much you're going to need.
They know how much.
Or do they
need.
more or less?
They know more or less how much they need, but it's the mass events that throw a wrench into it, because it'll pull everything, and then there's nothing left for the cancer patient or the woman that's delivering a baby. Or, in San Antonio, we're lucky to have a program called Heroes in Arms that gives whole blood on site. And I think in the first year that program was in effect, there are 155 people walking around that would not have been walking around if they had not received whole blood on the scene of whatever the occurrence was. And that there was one that was a woman that was in a car accident having a stroke. And there was another guy that about lopped his arm off with a piece of equipment of some variety. It just runs the spectrum. But that whole blood program we are the first place in the world to have it, and many places have tried to mimic it, and with more and less success, because there were 42 or 43 entities that had to agree to cooperate to make that program work. So it is a very complex program. And because we have so many people retiring out of the military and stay here, we had a lot more people that knew each other. Right. So it was a little bit
That would make
easier
sense.
to accomplish. So, but I know that program has been replicated, not just domestically, but internationally as well. But here was still the first. And it used to be called Brothers in Arms because it requires low titer O blood. And now they have a way to get that out of women's arms too.
Wow. I mean, this is all fascinating to me because I know nothing about it other than I go and give blood once in a while.
Mm-hmm.
I'm going to give it more
Keep
often.
doing that.
I'm going to give it more often
Yes.
after this conversation. Let's talk about, again, I've got to look back, NAWBO, National Association of Women Business Owners.
Mm-hmm.
What does this organization do, and how are you involved in it at this time?
So
I know that you were chair.
Member. I'm a retired member at this point in time, but after I moved to San Antonio, I had a mentor tell me, you need to go check out this organization. I think it would be really good for you. And there was a woman there. She's a friend of mine to this day. Her name is Barbara Green, and she just kind of understood that I wouldn't stay in an organization if I didn't have a job. So she started giving me jobs. And I stayed, and then I went on the board, and then I kind of went through the board, and I was the chair-elect, then I was the chair, then I was the immediate past chair. And I think it is the only entity in San Antonio for women business owners. This organization was founded now about maybe not quite 35 years ago, and it was designed to help women business owners develop connections among women's business owners and to improve access to capital, because women tend to be severely underfunded. So this was an organization that was designed to help with that.
Does it do anything to help with business sense and a sense of how to run a business?
It does. And the San Antonio chapter has a couple of different programs that are geared for women at different stages of business development. So they have some programs for women that are just starting businesses. If you're younger or older or whatever, but you're just starting out and you need some help, you can get it there. If you are in the middle space, kind of the $300,000 to $700,000 in revenue, there is a group that is designed to help you get where it is that you want to go. And then they have the Million Up group, which is for businesses that generate more than $1 million in revenue and has been one of their most successful programs. And then they bring in speakers, and they have a mentoring program that helps at-risk young women understand, hear, see examples of women that own businesses and run their lives and contribute to their communities. And there are awards for the young women, and then they also have business recognition awards for their members and the community at large.
Sounds like a great organization.
It's a wonderful organization.
Do you think, Allison, that in today's world, do women still have challenges that men don't have when it comes to starting a business?
I think so. I think that women, there's this great book called The Confidence Code, and it's written by a woman named Katty Kay and somebody else named Claire. I have forgotten her last name. I'm very sorry. But it is a wonderful book about how confidence develops in women. And one of the things that really jumped out at me when I read that book was that in the research, you can see that a man will apply for a job. And I know that's not quite right for women business owners, but I think the statistic applies, that a man will apply for a job when he meets 50% of the qualification. And a woman will only apply for a job when she meets 100% of the qualification. So I think that carries over into every
That's a high
other
bar to
area
place
of
on
business.
yourself.
It is a high bar to place. And I think that follows into the entrepreneurial or business owner world. And so I think women do have a different set of constraints. And I don't necessarily know that it's easy for men either. That's not what I'm saying. But I think they do have a different set of constraints. And I think access to capital is absolutely still a problem.
For many people, women and men, have you ever met a young lady that you talk to her, you visit with her, you see how bright she is, and she's got that spark, but somehow she's talked herself out of opportunities because she doesn't think that she has enough confidence or she doesn't have enough confidence to do it?
Yes.
And what do you say to them?
So you try to help somebody develop the confidence and introduce them to some resources, but ultimately you have to decide that for yourself.
And yeah, I don't know that there's a way to give somebody confidence. You have to build that and earn that.
It is, but I will also say that you also have to see yourself, right? So the teen mentoring program, I think, is so important because it takes young women that may not see woman-owned business or this is my idea and this is what I did, and create something with that. They may not see that. So if you can see it, then you can say, oh, maybe I can do that too, in whatever way it is that works for you. And I also think that, not a lot of businesses are started by 20 or 22-year-old women. A lot of women go to college or not, they work for a while, then they have an idea, and they may be 30 or 40 or 50 or 60 or older before they start their own business. And I think it's important for young women to see that there can be many paths that they can take. They don't have to just do one thing. They can start here and go here and go here and go here, and that's all fine.
There is no right one road.
Correct.
Yeah. Let's talk about another nonprofit, Impact San Antonio.
Oh, near and dear to my heart.
Let's talk about that. Tell me about that.
So I firmly believe that if you want a seat at the table, you better get out your checkbook. And I think Impact San Antonio is a great gift to San Antonio and a great gift to its membership. So I was a founding member of Impact San Antonio, and I write my check every year. And if I want to serve on a grant review committee or I want to volunteer to help with all the events that are going on and all the things that they're doing, I can. And if I don't, I can just write my check and I'm good. And we see people kind of come in and out of that, get more and less involved depending on what's going on in their life. And it is impactful. We've, for the last 5, 6, 7 years, given away $500,000 a year. And that is not 10,000 here and 20 here. And there's nothing wrong with that. We need that. But these are $100,000 grants designed to make an impact in whatever it is that they are doing. And as a founding member of Impact, that first year, we scrounged together $25,000. And we gave that money to the Arc of San Antonio, and they rehabbed a classroom. And Impact is now 21 or 22 years old, and I still remember that. I remember the second year when we raised $52,000, and I watched how people voted for one particular program and why they voted for that.
And how do you come to those decisions? What factors into your decision? Because I mean, there's a lot of worthy organizations.
There are a lot of worthy. So I think a couple of different things impact or affect. So first off, everybody votes, right? And my favorite was when everybody voted that night and the winner was announced. That the winner is still announced that night, but voting happens earlier. But when the voting happened that night and there was a group counting the votes, and then they came out and they made an announcement, and it was a remarkable experience. And now they vote earlier because it's 500 people and you can't count that many votes at one time.
No.
So you vote earlier, but it is the general criteria are one, fiscal responsibility. Okay. So there is a special team that vets applications for fiscal responsibility, right? Are they going to be good stewards of the money? And then it is, my criteria is usually, can they get the money elsewhere? Is this particular project impactful? Why? How many people? Is it sustainable? So a lot of the projects are project-based. Like Roy Moss Youth Alternatives has won twice. Once was to remodel their kitchen and once was to replace their AC. So that is a project. It's done. It's impactful for a long time. There have been a whole host of winners who just, it's this project and it impacts so many people and this is why. And we tend to fund smaller nonprofits that are responsible and doing fiscally responsible to their constituents and addressing a specific need.
And is there an application process?
Oh, yes. There is an application process. You have to go to a training, and it is a very rules-driven process, and there is a lot of review. There is follow-up to see if the money was spent appropriately. In fact, one year we had an organization that couldn't use the funds the way that they were supposed to be. They gave them back, and we gave them to somebody else.
Wow.
We gave them to the
fantastic.
runner-up of there was some construction problem or whatever. They gave the money back, and then we gave it to somebody else.
And did they submit again the next year?
They did.
Yeah.
So and what I also notice is that sometimes it may take 2 or 3 years until you get selected, right? So we've always encouraged people to come back because you may not get money the first year, but you may get it the second year. The other thing that happens is if somebody likes your project, they may come talk to you and they may write you their own check, or they may ask to serve on your board. And those are wins as well.
Yeah, absolutely. And I think that there's something that you get out of serving on an organization like that is in service of other people. You can't get that from a job.
No. And so Christian Senior Services, one year we gave them $100,000 to buy new trucks. And they said, thank you to Impact San Antonio. And I will tell you that every woman that saw that thought, oh, I bought that bus. I bought that.
That's funny.
Mm-hmm.
We all talk about our successes, but really and truly, most people learn more from a failure than from a success, if we're being honest. What's a failure that you've had in your career, your life, that's you came out the other side and said, this is, I'm glad this, maybe even I'm not glad this happened, but I can see how this impacted me positively in the end?
So after I decided I couldn't be captive to the insurance company that I was captive with for a long time, I started an enrollment firm. I am temperamentally unsuited to that. And it took me about 2.5 years to figure that out. And then I was like, I can't do this.
Yeah.
I'm terrible at this. I cannot do this. And pivoted into the space that I am now. So it was a win, but it was a lot of drama in the middle there, I got to tell you.
But it eventually took you to where you were supposed to be.
Yes.
Yeah. I've been through those too. It's
Why
not
did I
fun
think
at the
this was a
time.
good idea?
It's not fun at the time you're going through it.
No, not
No.
at all. Not at all.
So with all of the challenges, I'm going to close with this. With all of the challenges that we have as a city, and there's plenty of them, just like any other large city, what gives you hope for San Antonio?
San Antonio is still a big, small town. And I find it very interesting. You know, I belong to a couple of groups of insurance advisors, and we're here and we're there and we're, you know, in many different places. And my clients tend to be more concerned about what is happening to their people than the budget. And our best clients always tell me some version of, look, we spend a lot of time and a lot of money. If we could spend a little less money, that would be great. But could it be useful? Because it's not working for anybody. And I think that is a much better way to look at the problem. It changes the solutions that are available to you. And, you know, I think we're at a tumultuous time, but this community still seems to be holding together.
I'd agree with that. I would. I'm proud of San Antonio. I'm proud of this area, and happy to be a part of it always. Allison, thank you so much for being here.
Thank you for having
Really
me.
appreciate it. If there was somebody out there that's a business owner who would like to get in contact with you and get take advantage of Altique consultation, how can they do that?
So we're pretty searchable on LinkedIn. Allison De Paoli at DePaoli, spelled a little bit differently. And Altique is our website, altique.com. We're easy to reach in either of those places, and we'd be happy to help anybody.
Allison, thank you again.
Thank you for having me.
We'll see you next time on the Bomba Pod. Thank you for tuning in to the Bomba Pod. If this episode encouraged you, share it with a friend, post it, and help us spread the inspiration. Special thanks to our producer, Dennis Ayotte, and to our sponsors, Window World and PJ's Coffee of New Orleans, for helping make these conversations possible. I'm Martin Bomba, and remember, your story matters, your voice matters, and your impact starts now. Until next time, go out and spread some kindness. Make the world a better place. The views expressed on this show by the guest or the host may not reflect those of our sponsors.